been steeped a lot in so many of the facets of healthcare, and today at this panel, it's really going to be the focus totally on older adults and the impact of everything that's going on right now. No big news to all of you, but the demographics of older adults are shifting dramatically. As a matter of fact, between 2022 and 2050, the number of older adults will soar by 47%. Right here in New York, we saw a 35% plus increase between 2010 and 2020. So here's the good news. People are living longer, and people who want to are working longer, and people who don't want to work longer are still having to work longer. And so we're sitting in this point of inflection in our world where older adults are really up against it, and we don't hear that discussed as much as it absolutely needs to. And so I'm really pleased to be joined by our panelists today who each come from a different perspective, and they'll tell you about themselves, but I am just so honored to share the stage with each of them. So I'm going to open it up to a question which is really timely now, in case any of you have been looking at your iPhones. I have seen a lot of iPhones out there. So you know that the president's, what did you say, skinny budget, was that the word somebody used? Came out this morning, and so very timely that we get to reflect on that also. So I'm gonna pass it first to Greg Olsen, who is the acting director for the State Office for the Aging, and working together 30 years, maybe, at least?
30
So here
plus.
we are.
Thanks, Beth, and it's great to be with both of you guys. I want to shout out to Nima, Kathida, and the whole team at Blooming Health. They've been spectacular partners. So, you know, this isn't a political conversation. I really appreciated the one before this. I missed kind of the end of it. This is a factual conversation. As Beth had mentioned, the blueprint came out this morning that shows the pluses and the minuses. Those are things you guys need to look at. A couple of weeks ago, though, the HHS budget and reorganization was provided to the public. And so it's interesting to have the types of conversations we're having today about moving forward, which we should. It's not time to panic yet. With all the good work of joining together clinical services, social services, addressing SDOH, adding technology, all of those things are the right things to be doing. Integrated care models to serve people of all ages regardless, right? That's what we're here for. But if we're not realistic and are a part of democracy, and I appreciate Commissioner McDonald's comments that your voice matters. I read this morning on the train down that the special election in Staten Island yesterday had 8% voter turnout. That's a problem. So if we're talking about social care, et cetera, we know that 60 to 70% of all healthcare costs have to do with social situations. The choices that we make, do you smoke, do you eat well, do you exercise in the environments that we come in? So social care is a huge part of healthcare. So I'm just gonna go through, again, on a factual basis. For our agency at the federal level, which was the Administration for Community Living, was dissolved. 50% of the staff were terminated. And then we got the what HHS was proposing. And I'm gonna use that word, propose, because it's not a done deal. We have 5 months to have an impact. Elimination of the long-term care ombudsman program, send people in to be the eyes and ears for quality care in nursing homes. Elimination of evidence-based programs like CDSMP, diabetes self-management, powerful tools for caregivers. The elimination of the health insurance information counseling and assistance program to help people with their Medicare Advantage, Medicare prescriptions, et cetera. We also put $145 million in people's pockets last year. Elimination of adult protective services, falls prevention, the LIHEAP program for energy assistance, the community service block grant, Title V, which is a workforce program that we administer as well as others, elder abuse prevention, traumatic brain injury, Alzheimer's research, rural hospital grants and offices of rural health, mental health and substance abuse programs, including overdose prevention and opioids, the National Center for Chronic Disease Prevention, disability planning centers, DDPCs at the state level, voting access for people with disabilities, and 16 healthcare workforce programs, including geriatrics, and that's just a snapshot of what is being proposed. So I'm gonna stop there. Proposed is the word, but if we sit back, a lot of the things that we're talking about here today come October 1st are going to be extraordinarily challenging. The folks prior to us said a lot of innovation can happen at the local level and cited COVID. That is right, but what happened during COVID? We had lots of stimulus money to do some of those innovations and changes.
Thank you, Greg. I think you're absolutely right. Recently there were proposed changes to Social Security, and I do work for AARP, so I do have to put that plug in. We pushed back, the public pushed back. There were over 2.5 million people who contacted their Congress members within a 2-week period. They heard us loud and clear. So I think Greg is absolutely right. We've got a 5-month runway here, and let's not waste a moment of it. I'm going to turn to you now, Sarita, because really, the Master Plan on Aging, which the SCAN Foundation has been so important to, right from the concept, so supportive of everyone across the country, and we can't thank you enough for that. But what does that mean right here in New York, and of course the other states that you also are helping so much?
Yeah, thank you, and also want to just appreciate the opportunity of being here with all of you and Blooming Health for allowing me to come today. I mean, after what we just heard and the outline, I think, it can be considered really sobering, but at the same time, I think we have tremendous opportunity, and we have things we can leverage right now, like the Master Plan for Aging, which we, across the country, they're actually calling the multi-sectors plans for aging. In New York and California, we call them the Master Plan. And as mentioned, I'm with the SCAN Foundation. I'm the president and CEO, and we are about bold and equitable changes in how older adults age in home and communities. So really our focus is what matters most to people, and it is about being able to reside in their home and community with dignity, with independence. And so these master plans for aging, like in California, are really this blueprint. And for California, it is a 10-year blueprint with over 100 initiatives that outline areas like housing, that I know David will talk about, talking about caregiving, talking about equity, how do we monitor progress? And I will tell you, as somebody who's on the Impact Committee, which is the oversight committee for the master plan in California, I'm gravely concerned because we have so many initiatives, and now with the looming budget cuts, we have to be able to demonstrate the effects of what's going to happen due to these cuts on the people that we most care about. And when we talk about cuts, I'll focus on what we are talking about in California. One is long-term services and supports for all older adults, and housing is health. And those are the two things, because California has one of the highest rates of unhoused in this country, and it's the fastest growing rate among 50 plus. So what we're trying to do right now with the foundation and other foundations is really try to lift up the voices of those that are currently being affected by the health system and having challenges. That's that baseline, but if these cuts do ensue, what are gonna be the impacts on them going forward? So we're really about ask them what they need and design the solutions for them, with them, not at them. And I think that's what we're concerned about. So we're really working on efforts to really engage the community. We heard the theme throughout that health is local. And so really that's what the Master Plan for Aging, this 10-year blueprint is really talking about all the different multi-stakeholder efforts that are underway, whether it's advocacy organizations, whether it's the private sector, the public sector. We have to make sure that we bring everybody together. We make sure we continue to be data-driven as well. So all I can say right now is we're leaning more than ever on the MPA as that blueprint, and being able to ensure that when the May and June budget comes out in California, and then the revise, that we don't have critical services like home and community-based care services, which are going to be the first to be probably on the chopping block, because it's not a federal mandated program. And that's what older adults and caregivers rely on for home and community care. So I think it's really, and I will just be very excited to say New York, and actually over half the states in the United States are actually actively looking at creating master plans for aging, or have done so. So we're really excited about the future of that.
Thank you. And when we think about the federal cuts, which we don't know, Greg has reminded us that we won't know till October. And meantime, our state budgets are getting done right now. New York state budget, we're like, We're just waiting, right? Moments away, right, Greg? Give us the inside word on that. But David, I'm wondering if you could talk to us a little bit about the affordable housing piece on that and really the crisis it means for older adults.
Certainly, and one, honor to be here. Blooming Health has done a great job bringing these collaborative conversations together. I go to lots of housing conferences where I don't see always a lot of people in the continuums of care having conversations. It's real estate developers and finance syndicates, but we don't start talking a lot about the care side. And so it's great to have the opportunity as a housing person to come and have this conversation. Our organization, we operate in about 25 different states and helping sustain affordable housing communities, 33 units in rural areas. We have 700 unit communities in major metros like Houston. And so housing, in my opinion, and Harvard cites this in a study, is about 20% of your health care is actually reflective of your doctors and the physicians that you work with. Your actual healthcare providers contribute to about 20% of your actual health. The other 80% can be directly tied to where you live and what you actually have access to. And so when you look at that housing is healthcare, right? The very first conversation of getting people healthy and having a sustainable life of wellness begins with where do you live, and is that a stable, safe place for you to live? We've seen that in Blue Zone conversations and countless conversations. But the scary part is there are some realities around housing in our country, and obviously anyone who's bought a home or seen rental increases knows that even for the well-employed, housing is a struggle. It's some of this, and I heard one writer say that homelessness or near homelessness really could be listed as the worst pre-existing condition or comorbidity that a person could have. If you don't have housing, every other risk factor is there. 1 in 6 Black Americans will be classified as homeless in their lifetime. 1 in 10 young people, 3 out of 10 people aging in foster care, and 30% of school-aged children. And as you look at the president's skinny budget and all of the cuts to CDFIs and community grant organizations that are going to reduce access to affordable and critical housing that's sustainable for people, it's just going to make this, it's going to make it less accessible. And one of the things I kept reading in his plan was, 2-year cap on access, 2-year cap on access to affordable housing, and this idea to prevent waste or remove people who are, abusing the system, when the reality is only 25% of Americans who qualify for affordable housing actually have access to it. So of all the people who qualify for affordable housing, only 25% of those people actually are being able to use the system. So we have a system that most people who need can't even get into because we don't have the units for people to live in. And when I look at this picture of myself that was only from a few years ago, and I look at myself in the mirror now, I can see that one thing is true: we all get older, right? The gray hair on my face tells me I am aging, and so if we don't find preventative care in helping people have stable housing when they are young and when they are working, what happens to our older adults, right? It's not just to me, it's not just finding housing for a person once they hit that age of retirement, which I don't know what that age is anymore, but it's how do we find stable housing for people throughout their working years so that they can have good health, good care, good wellness, raise their children, and then we can reduce the health needs that exist when we get to older adults who maybe have dealt with that instability of housing throughout the entirety of their lives.
It's interesting you talk about that, but also as you age, you're more likely to end up living alone. Mm-hmm. And what is the impact of that? And what is that impact of that in the housing that you have? As a matter of fact, the data that I looked at is that older adults, it's over 35% of them are now living alone. So that is a whole other combination of worries about isolation and everything else. And we know that if you're living alone, if you are isolated, that loneliness, that isolation is the equivalent to smoking 15 cigarettes a day. Mm-hmm. We all know what the impact of that is on our health, so it's really important to raise that. So thank you, David. We're here with Blooming Health, so it would be terrible if I didn't ask the next question, which is, what is the role of technology and AI in addressing all of the spheres that you're in, and also within workforce issues? So both writ large, but also within workforce. And who wants to start with that one?
I'd be happy to. My picture's 15 years old. I feel your pain. Yeah, technology plays a crucial role. So we've launched since 2018, 28 public-private partnerships with tech companies. We're serving 1 million more people and filling a ton of different gaps. I would be remiss if I did not do the shameless plug for the efficacy of Blooming Health. We started with a small project. We are now in 43 counties. Hundreds of thousands of users, clients that we serve are on the platform. But of the 28 partnerships that we have now, we have measured all of them. So Blooming Health, we see a 300% increase in engagement, 500% increase in SNAP applications, 10% reduction in loneliness, 7% increase in overall health and wellness. And one of the most important thing is 2 hours a day savings of our case managers' time because they don't have to make 1,000 phone calls because of the two-way connection. Of the clients we're already serving, and these folks have case managers, I was one, that you talk with folks regularly, identified 40,000 additional social needs from our customers, anything from economic security to transportation to nutrition and so on and so forth. So I am a huge fan of not only Blooming Health, but many of the other things that we have launched and sustained or are piloting now to help individuals with Alzheimer's disease and their caregivers, strengthen fall prevention programs, many that have different aspects in terms of combating loneliness and isolation. Several of them that are working directly to support those providing uncompensated care to somebody else, like caregivers. So it's been amazing. We have a report on our site, aging.ny.gov, that has 18 of them with the outcomes measures, and then we have 11 additional ones that we'll be publishing soon.
It's so important to make sure to underline that, especially after hearing from Dr. McDonald about preventative health and what could be more in the realm of preventative health than those 18 measures that you're talking about. So thank you, Greg. And Sarita, I think you had something to add to
Yeah, I just wanted to add, I think, well, first of all, I'm also a practicing internal medicine physician, and I call myself a card-carrying member of AI with the caveat that we have to be thinking about ethical AI. And so a couple of things. One, first of all, I've had the opportunity as a clinician to use the AI ambient tool to record my conversations, my interviews, the exams with older or with patients in the clinic. And I will tell you, it does reduce burden, in terms of burnout, that pajama time they talk about when you have to go home and chart for hours on end after you leave the clinic. So it is definitely, and it's getting better and clearer. You still have to review the notes and make sure they're accurate and it hasn't misrepresented your individual. So I will say that is great. I think one of the things that our foundation that focuses on, again, home and community care and making sure that we're focused on marginalized communities of color, lower income older adults, and older adults in rural settings, is that the data often is not representative, that feeds into those AI algorithms is not representative enough. There is algorithmic bias that still exists, and I won't cite all the numerous articles that have come out and demonstrated that. We have to be really cognizant of the inputs of the data to make sure AI is effective and it really does address the needs of populations, particularly marginalized communities. But I think there's tremendous opportunity to improve efficiencies in ways that I think was already mentioned, Greg already mentioned. And so I'll just say that we are on the journey. One thing I'll also say is that in the federally qualified health centers and the low income, the areas that serve low-income populations, they don't have often the funding or access for these type of robust AI solutions. So I think one of the things that is being looked at, I think across the country, is how do we do more supports for those communities. So I think a tremendous opportunity, but we have to be very cautious and cognizant.
Yes, yeah. Sobering words, but so true. I just want to go back to you, David, on the technology and AI side of this.
Yes, no, certainly. I've learned so much just about Blooming Health and then the ability to close the gap on a lot of staffing needs. Our organization's a nonprofit and we just serve diverse communities. And so having solutions to fill language barriers when you can't find staffing in certain areas of the country to meet the needs of particular populations, so there to be another solution. One thing that we're using AI for is to really be predictive of where does housing need to be, where in the country is it needed most, how are populations changing so that we're building the right type of housing, all the way drilling down to being predictive of a family's needs and understanding where will they have rental shortages throughout the year based off of climate, increased cost, utility cost, going back to school, so that we can help families budget and plan better, especially aging adults, to understand how are the cost of your medication and your changes going to affect your ability to sustain your housing. Because the worst thing we want you to do is to lose your housing, to be unhoused, and now we have an entire other cycle of issues that we have to address. And so the hardest part is, I would say from my perspective, is getting state agencies to embrace the data that technology is giving us, right? I'm from Texas. So there's very much an old way of doing things, and this is how we do business. And getting Texas and other red state agencies to embrace new ideas of this is how we need to look at housing availability. These are the metrics that we need to decide where we build it, and using that to try to overcome NIMBYism, which I deal with most of my days, of trying to convince communities that affordable housing is going to help improve your neighborhood. It's not going to take it back to some age that never existed, and using AI to shape ways to have those conversations, provide that data to those people who need it, and hopefully inform them to make better decisions.
Thank you. So if you had a magic wand, but not endless resources, what would be, and this is to each of you, your bold, fundable ideas that could really drive meaningful change in your areas? Oh, Greg, you're...
Changing the financial incentives. Behavior doesn't change until you change the financing model. I think somebody said this morning, most of the dollars that we spend in health and long-term care are reactive to somebody's condition. That's exactly right. 97% of funding is spent after somebody is sick. 3% is spent in the community. As you know, you have over 2 million members. We have 4.84 million people in the state of New York over the age of 60, and a little over 100,000 nursing home beds. That math doesn't work. Nor there's always going to be a role for residential facilities, but it's not the first line of defense, but that's the system that we have. And one of the things I've always said is, growing older is not the problem, it's how we've organized the caring economy, and it's backwards. So the number one actionable thing is to change the incentives that get social care, clinical care, technology, housing together so that you're actually serving people holistically, proactively, not reactively.
And I think honoring what it is that they want. And you said this also, Sarita, which is when AARP surveys people forever, like how do you want to live out your days? And 80 to 90% every single time want to live in their own homes.
So I got to ask you about that,
and
because I cite that
communities.
all the time. Who's that 1 out of 10 that doesn't? So it's
There-
usually 9 out of 10
I think it's
people
the
want to
one
stay
that's
at home. Who's the one?
grandchildren moved to North Carolina,
Gotcha.
and they got to be near their
And
grandkids.
who's the dentist that doesn't, the 4 out of 5 dentist trident? Who's that one dentist?
Yeah, that's a good question. Yeah, no, I want to just dovetail. Yeah, I want to dovetail off of what Greg mentioned, because I agree. Like we have to align the financial incentives here. If we're going to do that. And I will say that, as I mentioned, and you've also cited this, we can't do this without activating the communities, the individuals who are going to be most impacted by these, like the cuts and the lack of financial alignment. And a couple of things that, I would say the magic wand would be is, like when you told me 8% showed up for that Staten Island, I mean, that's voters. That to me is very telling that we need to do a better job of supporting people to feel that they have agency and they have an active voice in informing these policies that will then, change the incentives. I'll give an example. We do a lot of policy informing work. We're not a lobbying organization as a foundation, and we recognize that we were giving a lot of important data. Getting the policy data and saying this is what we need. This is what, and all important. The data, the quantitative data, But what really resonates with policymakers, with legislators, are those stories, particularly from people from their own districts. And so we have now helped create, and we're shaping this with many inputs, a platform called The People Say. And it is a curated, just stories of individuals talking about their healthcare needs. And you can go onto that website, and I encourage you and love your feedback. Thepeoplesay.org is like to be able to say, you know, like if you want to look at financial security, you can pull the stories from people from 8 different states, and maybe more now. We have red, purple, blue states, rural, urban, different demographics, and being able to pair that with the data, and then basically follow up with these individuals. One thing we did is we consented these folks to be part of the platform, which they did, but we also said to them, but when we're gonna come back to you. We want to not only to ask how things are going with you, so longitudinal, but what were we able to accomplish with your voice and your input. And we're doing this also with communities as well. And actually Blooming Health, you know, call out, we're funding a community organization in a rural part of California, and Blooming Health is being used to communicate to these communities about what is going on, events, what they should be made aware of, because a lot of times they don't even know what's happening is gonna impact their care. So building those connections is gonna be really important. So that would be my magic wand, is that we gotta mobilize, and we gotta organize, and we're not gonna do it. It's gonna be the communities that do that.
Well said, thank you. David?
So if I had a magic wand, I would just make housing the very first list item on everyone's list across the country. You know, I was looking at the New York, you know, master plan, and I think some of those things are great. You know, I'm sure cell phones in school is a problem, you know, $13.5 million for that. But I also look at $15 million can build 200 units of affordable housing for a 30-year period that exists, you know? And so I'm not saying one is more important than the other, but we see what housing does for people, you know? And if at $15 to $20 million, you can build 200 units of affordable housing, if state and local dollars are reprioritized to giving people a place to live that they know will be there for them so that they can pursue health, wellness, work, you know, life, raise their children, how do we change society? You know, how do we make the world just a better place for every single person? The number of people who I have met who could not access care, services, benefits they qualified for simply because they did not have an address that they could utilize to put on an application to apply would break your heart, you know? And so I think the foundations of our nation this is a place where we can call home, you know, land of the free, home of the brave, but having a home is something that so many Americans lack, and we forget that it's just a foundational part of living in, you know, one of the greatest countries in the world. And so if I had a magic wand, you know, I would fix homelessness. No one would be unhoused. We would all have a place to live. And then that's really the start of us reaching every other goal for our life.
So David, you're gonna love this, because it sounds like there's synergy between Texas and New York. So Governor Hochul has a 5-year, $25 billion housing plan. Mm-hmm. But the problem is exactly what you identified. We're both home rule states. Mm-hmm. And if the municipalities don't change the zoning to allow them, you can't build them, even if you have the dollars. So I think she recognized that and then provided more than $100 million in grants to municipalities to actually do the zoning changes so that they could get the housing. But you're spot on. The number one problem is that it doesn't matter how much money you have at the state level if you can't get the municipality. So if you don't really see that, does it exist?
Sorry.
And just to follow up one last thing, it was a time thing that if you don't look at it, it really doesn't exist. Your voice really does matter. So folks at home, one of our partners, the Association on Aging, and their director, Becky Prevey, set up a website, agingny.org, that has all the things that I just talked about and an easy way to take an action. I used to work in the New York State Assembly for a member, and constituent calls matter. And they pay attention. So if you think that they don't, or they don't listen, that is wrong. They do. So again, these are things that are proposed. If you care about them and are worried, weigh your voice in. If you support them, you can do that too. But I think it fits perfectly with what we're talking about today and how we make ourselves healthier and better and more connected. And those types of things are at risk with these proposals.
Sarita, do you have anything more to add?
No, I mean, I thank you for that summary because and if there are ways we can collectively work to bring the, our voices, and the voices of the community and help them feel that they have that agency and that opportunity to shape the policies that align incentives, I think that's where we should put our resources and time at this stage because they are listening, but we have to give them examples. And I don't think just the quantitative data alone is going to be sufficient at this stage. But I mean, and I will also say that we have to forge partnerships that are not necessarily the most normal, like common. Like I know with you do a lot of public-private partnership, and I'm a big believer that we have to be doing more of that in this day and age when resources are constrained. So I think being creative and I think and scale, I think are the two things that are going to be really important as we go forward, and efficiency.
And I would just add, now is the time to raise our voices, to make sure that what's important to us and to our services and what we advocate for and everyone that we're serving, that make sure that we're raising our voices, but they have the opportunity to raise their voices too. And you're so right, and to tell their stories. That is so important.
Yeah, it's also the 60th anniversary of the Older Americans Act, Medicare, Medicaid, and the 90th anniversary of Social Security. So happy
Yes.
birthday.
Thank you, everyone.
Thank you.